We're glad to have you here at St. Francis Home today, and we're very appreciative to have David Painter here with us. Dave, what do you prefer?
Either way,
Okay.
Dave's fine.
Dave, you'll answer to anything, okay. We had Dave and his, some co-workers with him here last year, and they did a presentation for us, and we've met him at other health fairs and different events, and am just so impressed with his knowledge and his way of presenting. I know I've had a couple people say, is this going to be simplified so that I can understand it? Because it's confusing and there's a lot to learn and a lot to know, and I think that he does a great job. I'm going to let him introduce himself a little more and tell you a little more about what he does. But again, I'm Leanne Smith. I'm the Director of Residential Services and Public Relations here at St. Francis. And so, again, we welcome you to our campus. If you have any questions about anything we can offer here while you're looking around, or you want to see any of our facilities, give me or Kelly Hartzell, my coworker, a little flag, and we'll be happy to help you with any of those questions. But otherwise, I will turn it over to David.
Great, thank you so much. All right, well, thanks for having me here, folks. As Leanne was saying, my name is Dave Painter. I'm here today with the Ohio Department of Insurance. Our division within the Department of Insurance is called OSHIIP, with a P. Very important when you say OSHIIP, you emphasize that P, otherwise you're going to get yourself in a little bit of trouble. OSHIIP, or I should say the SHIP program, we are one of 54 programs. There's one in all 50 states and all 4 U.S. territories. We are all tasked with the same thing, which is providing Medicare education to you, the consumer. Okay? There's a lot of agencies, or I should say a lot of folks out there who are willing to give you a presentation on Medicare. At the end of the day, most of those have a product to sell. We are part of your state government. We don't have a product to sell. We have nothing to sell, promote, or endorse to you. All our information is 100% impartial. How we disseminate this information, we have a lot of publications. I've given you guys the PowerPoint that I'm going to be using today, but then I also gave you this booklet like this. This is hot off the presses. This came out Monday afternoon. So it's about as recent as we're going to get. And it really goes into more depth than what we're going to be able to talk about in the hour we have today about Medicare and some different things. That's one example of publications we have. We have speakers like myself who go all around the state and do these presentations. And there are actually 5 of us for 88 counties, for all of the state of Ohio. In Ohio, there are 2 million folks on Medicare, and every month we add 10 to 15,000 new people, just in Ohio. I'm not talking the country, just in Ohio, to Medicare. So if you're, do the math, that means I'm supposed to reach about 400,000 people a year. I don't do a very good job of that. So what we do instead is we train volunteers, and volunteers then become our local people. They go through a very intensive training. It's 5-day-long training. You get an update every year. And we sort of have those, sort of our local folks, in the field. So a lot of stuff that I say OSHIIP can help you out with, we do have some local people. Am I allowed to point at you or not? I can? Okay. Any of you who know Tom over here, Tom Joseph is one of our OSHIIP volunteers who lives right here in Tiffin, Ohio. And we have, one, actually just one other in Seneca County. We got one down in Fostoria, but we do have some folks around to help out. We have our website, which is on front and back and almost every page of this packet, insurance.ohio.gov. Any of you who are online, who are comfortable on the internet, it's a pretty good website. You go to it, it takes you to the Department of Insurance. There's a bunch of tabs at the top, and one of them says Medicare. Click Medicare, it takes you to our page. And then we also have our hotline number, 1-800-686-1578. It is on every other page in this book, at the bottom of the page. Every other page it says, call us with your Medicare questions, and has that hotline. Our hotline is staffed 7:30 to 5, Monday through Friday, answered by actual human beings who are sitting in Columbus, Ohio. So you're talking to folks right here in Ohio, not some country you've never heard of. I will tell you guys the secret if y'all promise not to rat me out. Does everyone promise not to tell on me? Okay, when you call, this is an election year. So when you call, you're going to hear the Lieutenant Governor Mary Taylor, who is our director actually. Lieutenant Governor Mary Taylor, she's going to go on for about 90 seconds about how wonderful we are. If you want to skip all that and get right in queue to the phone ringing, someone answering the phone, just hit 0. But when that happens and someone answers, don't say, hey, Dave told me just to hit 0 and it worked. Okay? Or if you want to hear what Director Taylor has to say, by all means listen. She's a very nice woman. So anyway, that hotline, it'll get you through any questions you have, all the way from simple thing, what's this premium going to be next year, to I want to compare my drug plan, I want to compare my Advantage plan. We'll help you any step of the way. It is, as I said, a state agency. It's taxpayer funded. You're paying for it whether you call us or not, so you may as well use it. You may as well use it because we all pay for it. Our hotline is a small group, and the only reason I like to point that out is a lot of times you call, if I called my cable company and had an issue, the next time I called back, I said, hey, I talked to Bill last time, can I talk to Bill again? They're going to tell me we don't know who the heck Bill is. We're a small group. There's about 15 folks who answer those phones. So if you do call and you talk to, let's say Peggy, for example, and you say, can I talk to Peggy again? The person you're talking to is going to know who Peggy is, okay? Small group. I think that was probably enough of a commercial. We're going to get into this. In addition to the booklet I gave everybody a copy of the PowerPoint itself. And you ladies in the back have one? Yes? Okay. These are the slides I'm actually going to use. So you can follow along up here, you can follow along down there, however you'd rather do it. All right. This still says 2014, but it's still true. The exchange, otherwise known as the healthcare marketplace, which is part of the Affordable Care Act, which is best known to all of us as Obamacare. What effect is that having on Medicare? Really nothing. Really did not affect Medicare at all. As far as your benefits go, nothing's changing. These plans that they're selling as part of the Affordable Care Act, these marketplace plans that we've heard so much about, it is actually illegal for someone to try to sell you one of those plans if you have Medicare. It's against the law to try to sell you one. Reason being, you don't need one, and they won't work if you have Medicare. They won't work. This open enrollment period, the reason I'm here, coming right up, October 15th and December 7th, I'm going to say that 500,000 times by the time we're done. This is sort of the high season for Medicare fraud, meaning this is when all the companies can market to you. So as a result, this is when all the criminals are trying to sneak in the back door. Do not, and I'm going to say this more than once, do not give your Medicare number out to anyone who contacts you unsolicited. Meaning, anyone who calls you on the phone, someone comes to your door, if you're at, a senior expo, something like that, and someone's asking for your Medicare number, don't give it out. Absolutely not. If you're calling us, we'll ask for it. If you're calling Social Security, if you're calling Medicare, if you're going to the doctor's office, they're going to ask for your Medicare card. But those are all contacts that you've made. Don't ever give it out unsolicited. Because generally, it's someone trying to steal your information. Okay. So what is Medicare? Most of you know. Federal health care, right? Federal health insurance. Actually, true groups of people qualify, 65 and older. That's what we tend to think of when we think of Medicare, 65 and older. But you also have any age and disabled. And by disabled, what I mean is if you qualify for Social Security disability benefits, after 2 years, 24 months, you're then eligible for Medicare. And any age and diagnosed with end-stage renal disease. That's permanent kidney failure, and you're going to see that pop up a couple times before we're done. This little graph here we've been using for a few years. Actually, I don't know how long we've been using it, but we've been using it as long as I've been here. This option 1, option 2. If you have Medicare, and I think most of the folks in this room are in that case, you're in one of those 2 categories. You're in option 1, original Medicare, may or may not have secondary insurance, hopefully have some sort of Part B, or you're in option 2, which is a Medicare Advantage. Most of what we're going to talk about today are these individual parts. What they are, how they work together, how they don't work together. And we'll figure out, hopefully, we'll know some of what these folks are trying to sell to you. This is red, white, and blue. Your copy's black and white because the state won't let me print it in color. But this is your Medicare card, right? I mean, yours doesn't say sample stamped across it real big, but otherwise that's what the Medicare card looks like. Covers your Medicare A and Medicare B. A says hospital. We could also think of A as inpatient stuff, because it's inpatient hospitalization, skilled nursing facilities, home health care, and hospice. Hospice is specialized end-of-life care. Your B says medical, but we could also think of that as outpatient stuff. So we're talking doctor's offices, preventative benefits. We'll talk more about that here in a minute. Durable medical equipment. Durable medical equipment's walkers, wheelchairs, oxygen, diabetic supplies, CPAP, RAD machines, all that good stuff that some of us need. And then outpatient services, meaning I'm going to the hospital, but I'm not checking in. I'm going to the ER, I'm getting outpatient surgery, I'm getting tests, I'm getting infusions, whatever it is, but I'm not an inpatient in the hospital. So that's what A and B are covering. Applying for Medicare, I know there's a few in the room who are still there. If at age 65, if when you turn 65, you've already taken your Social Security benefits, so you're already getting a check from Social Security, or railroad retirement, if you or your spouse retired from the railroad, you don't have to sign up for Medicare. A card will just show up in the mail. And some of you folks on Medicare, that's probably how it happened. The card just showed up one day in the mail and you said, hey, I must have Medicare. The rest of us, if you're not getting Social Security benefits, or if you're like me and you're still going to be working well past 65, you actually have to sign up for Medicare. Signing up for Medicare is pretty easy. You can do it online at medicare.gov. You can, if you don't want to do that, you can do it in person at Social Security office. When to sign up, there's a 7-month period. 3 months before you turn 65, the month you turn 65, 3 months after. So you got that whole 7 months to sign up for it. I strongly recommend the 3 months before you turn 65. Reason being, if I sign up beforehand, let's say today was my birthday, and today is the 25th, I think. I don't even know what day of the week it is at this point. Let's just say the 25th. If I had signed up beforehand, my benefits would have started September 1. Even though I was still 64 on September 1. The other reason to sign up beforehand, not that this has ever happened, but let's say the federal government screws something up on your card. They spell your name wrong, or your number's not correct. You want to have a little time to fix that before you actually start using the benefits. Does that make sense? Okay. This slide is also not updated for next year. And I bet you this is the thing that some of you came to hear. As far as some of the Medicare amounts for next year, they haven't announced them yet. So as far as the hospital deductibles, the skilled nursing, that sort of thing, we don't know what it's going to be for next year yet. I'm going to give you a hint as to when we'll probably hear this. But there is one thing I wanted to hit on this side, on the Part A side. To go to a skilled nursing facility. So I go to the hospital. Medicare is going to cover me in the hospital, right? It'll actually cover you up to 150 days in the hospital. But who do you know has ever been in the hospital for 150 days? Typically, you're in the hospital for a few days. And if you can't go home, if you're not well enough to go back home, you're going to come to a skilled nursing facility. Under original Medicare rules, original Medicare now, you need to be inpatient in the hospital for 3 midnights, 3 days, for Medicare then to pay for that skilled nursing stay. Once upon a time, that was very easy to keep track of. If I'd been in the hospital for 3 days, I'd been in the hospital for 3 days, right? Now they have what's called observation stays. Basically, and I see heads nodding, some of you have experienced this unfortunately. What observation days are, I'm in the hospital, I have a bed, I have a gown, they're doing everything for me they would do anyway. However, according to the hospital, I haven't been admitted yet. I'm still outpatient. In which case it's being covered under my Part B, so I'm still getting coverage, but it's not counting towards those 3 days I need for skilled nursing. The reason I point this out to you guys, we have really no rights there. We can't go and demand, I need to be admitted today. We have no right to do that at this point in time. I do strongly recommend A, being aware of it, and B, communicating it with your loved ones so that you can at very least continually ask, what's my status? Have I been admitted? You know, my wife's going to need to go to skilled nursing when we get out of here. I want to make sure we get our 3 days in. Doctors are tending to work with folks, but unfortunately, no one's actually going to more likely come up to you in the hospital and say, hey, FYI, just to let you know, you haven't been admitted yet, so you don't start counting your 3 days. It's up to us to know that. It's up to us as consumers to know that. So I say, don't just know it yourself, communicate it with your loved ones, because there's a real good chance if you're in the hospital, the last thing you're going to be worried about is what's my admission status, if you're even able to talk, depending on what could be wrong with you. Important to know that. The monthly premium. I guarantee some of you came today saying, I want to find out what my Part B premium is going to be for next year. I would like to know that too. The federal government hasn't announced it yet. Typically, they don't announce the Part B premium until late October at the earliest. More likely, early November. Generally after Election Day. And you all laugh, wait and see. It's generally after Election Day. I will say this, it has remained 104.90 for the last 2 years. 2013 was 104.90, 2014 was 104.90. I will be shocked if it remains the same for 3 years in a row. So we'll wait and see. We'll wait and see what that's going to be. I do want to mention this for the younger folks, late enrollees. So let's say I signed up for my Medicare. I took my Part A because I paid for my Part A. You pay for your Part A through work. Either you or your spouse worked, you paid into Medicare, you paid for your Part A. But the heck with my Part B, I'm not going to take it. Why would I? You know, I don't get sick. I'm not going to pay them $104.90 a month. Well, here's the deal. Every year that you're eligible for Part B that you did not take it, you get a 10% penalty added onto that premium. And that 10% penalty you will then have for the rest of your life, every month for the rest of your life. So if I waited 5 years, I'm going to get a 50% penalty. And whatever that premium is, I can add 50% to that every month for the rest of my life. There's one way to not take B, not take your Part B and not get that penalty. One way and one way only. That is if you are still working and you have health insurance through your employer, or your spouse is still working and you have health insurance through their employer. But it's got to be current employer coverage, meaning either I'm going to work or my wife is going to work, and whoever it is who's working, that's who my insurance is through. If that's the case, I don't have to pick up Part B until such time that I no longer have that coverage. I can pick up Part B and I don't get that penalty. One and only way to avoid that. Everybody else has got to get it. Everybody else has got to get it. All right, preventative benefits, there's a whole list of things, and actually the book, I don't want you to try to find it in the big book, lays it out a little better than this slide does now. Whole list of benefits that you shouldn't be paying for if you're on Medicare. One I do want to highlight today, over here on the right-hand side, flu shots. You're hearing about this every day now, right? Get your flu shot. If you're on Medicare, you shouldn't be paying for it. Should not be paying for your flu shot. If you're going to the doctors to get it, they can charge an office visit. Absolutely, they won't charge you for the vaccination. If you're going to the drugstore, grocery store, whatever it is to get it, you shouldn't be paying a dime. I would caution you before you get the shot, verify that. Say, hey, I'm on Medicare, this doesn't cost me anything, right? Just to make sure. There was one chain a couple years ago that did something a little bit shady on that and put in an administrative fee. Make sure they don't have one of those. And if they do, you can pay it or go somewhere else. If it's me, I'd go somewhere else. It's $10 at this store and $0 at that store. I know who gets my business. All right, A and B. A lot of folks, that's all they have, A and B. A lot of folks want something to supplement what A and B did not pay for. They don't want to pay that 20%. They don't want to pay the deductibles. So they have some form of secondary insurance. Comes in 3 groups. Group health insurance. What this is if you or your spouse worked somewhere and when you retired, you continue to have insurance benefits that followed you into your retirement. Meaning your insurance benefits continued. That's one form. Medicaid is another form, and what that is state assistance for people who are under certain income guidelines. So it's low income help. There's 3 programs called Medicare savings programs that supplement Medicare. Where Medicare pays first, it's going to come in after Medicare and pick up some, if not everything, Medicare did not. And then the third one we're going to spend a minute on is Medicare supplemental insurance. Medicare supplemental insurance. Now we're talking about a private policy. We're not talking the government anymore. We're talking about a private insurance company that you, if you choose to, buy a policy from them, sending them a premium every month. The premiums for these are not particularly cheap. The average for the state, now keep in mind I'm talking the average here, about $200 a month per person. Some folks can get them a lot lower than that. Some people paying a little bit more. That's where the average comes from. About $200 a month though. And what these plans do is they come in after Medicare pays and pay some, if not everything, that Medicare didn't pay. And most of the plans pay everything Medicare did not. So you're giving them the premium every month, but on the back end of that, you're not getting any bills. All companies sell the same plans. What they mean by that are these plans are, just to make life confusing, listed by letter name. So forget the A and B we already talked about. A, B, C, D, F, G, K, L, M, and N. What standardized means is a plan F covers the same things at the same rate regardless what company I buy it from. It basically looks like the same coverage regardless who I buy it from. A plan N, regardless what company I buy it from, it's going to cover the same things at the same rate. As a matter of fact, the only difference between the different companies are going to be what they charge you. It's going to be the premiums. So two companies will charge me a different premium for identical coverage. How does that work? Well, they're a private company. They charge what they think you'll pay. A lot of times I equate it with a car dealership and say, you know, I can go to a Ford dealership, two Ford dealerships, look at the exact same car, all the same bells and whistles, and they're going to quote me two different prices for that car. Same sort of deal. Same sort of deal. These plans are awful nice. You have no network to worry about. You go anywhere. Any doctor that accepts Medicare is going to accept your supplement plan. They pay after original Medicare. And then for you young folks, there's this guaranteed issue period. What this is for the first 6 months that you are both 65 and have started your Part B. So both of those have to be in place. I'm 65 and I have my Part B. I'm in a guaranteed issue period. You can sign up for any plan sold in the state of Ohio. They have to accept you as a client, and they can't ask you health questions, to disqualify you. They can't ask you any sort of health questions. That's for the first 6 months. Once we're beyond that, you're now in the open market, essentially. Meaning, you can still apply for any plan sold. You can absolutely apply for any of them. Now, however, they're going to ask you health questions. They're going to want to know your health history, anything that's ever gone wrong. As a private company, they have the option of saying, no thanks, we don't want you as a client, you're too sick for us. They can also say, yeah, we're going to take you as a client, but because of your health history, we're going to adjust those premiums. And they only adjust premiums in one direction. I only know one way to go. Now, having said that, I don't want you to hear that and say, if my 6 months are gone, then I can't get one of these plans. Okay, they are in the business of insuring people over the age of 65. So blood pressure, cholesterol, things like that are not going to disqualify you from one of these plans. I'd more throw it out as a caution, as if to say, don't wait until I'm diagnosed with cancer to go try to pick up one of these plans. Then it'll be too late. Don't wait for something catastrophic to happen, if it's something you're interested in. So, two pieces of the puzzle down. Original coverage, secondary insurance. Some folks have it, some folks have no secondary insurance at all. Hopefully, you have some sort of drug coverage, and that's Medicare Part D. Everybody with Medicare can pick up a Part D plan. There are 35 this year, 35 different drug plans to choose from this year. They're available two different ways. There's the standalone drug plans. That's what goes to the option 1 that we're talking about right now. And then there's also the Advantage plans. Medicare Advantage plans, that's what we're going to talk about here in a minute with the option 2. The open enrollment period for these are coming right up. October 15th to December 7th. If you're on Medicare, you cannot possibly forget this because you're going to get mail every single day. If it hasn't started already, it's going to start really strong October 1st. Because that's when all their marketing material comes out, and you'll have 3-4 ads in your mail every single day. So I'm not worried about you guys forgetting it. This is the time of year where you can change your drug plan, you can compare your drug plan, you can drop a drug plan, you can pick up a new drug plan. What are you comparing for? 3 C's. Convenience, coverage, cost. Convenience meaning, can I buy my prescriptions where I want to buy them? If I always want to go to Walmart, I want to make sure I have a plan that's accepted at Walmart. If I want mail order, I want to make sure my plan will send them to my house. Coverage is obviously a big one. It's got to cover your prescriptions or it's not the right plan. Not the right plan for you. And cost is another big thing here. Now you can see down here where it says you can compare these plans at Medicare.gov. You absolutely can, but I'm going to give you a couple other options. You can give us a call on that hotline that I said is in the couple pages in here and on every other page of the booklet there. say, hey, I want to compare my Part D plans right now. Do a comparison for me over the phone, mail me something. You could also say, hey, I want to do a comparison, but I want to try to meet with someone in person. We'll set that up for you as well. We will help you do it. Regardless how you go about it, we're going to do the same thing. We're going to take your information and your drugs. So we would need to have a list of here's the prescriptions I take, here's my dosage, here's how often I take them. If you go to one pharmacy, ask them to print it for you, because they can give you a printout of that. Get that list. We will put it in Medicare.gov. What it does then is it takes those 35 plans and it ranks them 1 to 35. Here's the least expensive plan to cover all of your drugs. Here's number 2, here's number 3, here's number 4, et cetera, et cetera, et cetera. We'll tell you 1, 2, and 3. I'm not going to tell you what the 33rd least expensive drug plan is, because it's probably not the one you're going to go for. We can tell you exactly what the premium is, what the copay on your particular drugs are going to be. We can estimate what it's going to cost per month. We can estimate what it's going to cost for the entire year out of pocket for you. We can compare it to the plan you have right now and see if you're going to spend more money on the plan you got now than another plan, or if there's another plan that can save you money. What we cannot do, either staff, volunteers, what we can't do is choose for you. We can't tell you what to pick. Absolutely not. No matter how much you beg, plead, cajole us, we can absolutely not pick it for you. We can tell you exactly dollars and cents. Here's a plan, it's going to cover all of your prescriptions. Here's exactly what it's going to cost. Or I should say an estimate, because we don't know that the copays do change somewhat. We can compare it to what you got right now and write on paper, say, you know what? This plan you're going to stick with right now, maybe it's going to cost you $400 out of pocket. There's another one showing that says it's going to cost $200 out of pocket. I can tell you that 10 ways to Sunday, but at no point can I say, hey, dummy, pick the cheaper plan. What are you doing? When it comes to these drug plans, I strongly recommend picking the cheapest one that's going to cover your drugs, because that's all we're talking about are prescriptions. We're only talking about prescriptions that you get at the pharmacy and give yourself. We're not talking your doctors. We're not talking your hospitals. And if for whatever reason you don't like that plan, change it next year. Change it next year. But don't leave money on the table. This is updated for 2015. All these standalone plans, the ones over here in option 1, have a monthly premium. This is again an average, that $30. There's one that's right around $12. The cheapest one's right around $12 for next year, and the most expensive one I know is $119. And there's like 33 in between there. It's like 33 in between there. Annual deductible, some plans have no deductible at all. The most they're allowed to charge for next year is $320, meaning the first $320 I would have to spend, and then the plan would kick in. When the plan kicks in, these Part D plans are a percentage plan, meaning the plan might pay 75% and you're left with 25% of that cost. That's a lot of times on brand name drugs. A lot of times with generics, it's $1, $2, $4 depending on what the generic is. Some of you probably have plans where you're paying 0 on generics. The coverage gap or the donut hole. Guys heard of the donut hole? I know you have, because we already talked about it. I shouldn't have pointed at you when I said that, should I?
It's okay.
I'm telling everybody her business. What the donut hole is when your total drug costs in a calendar year, meaning what you paid in a copay and what the plan itself paid for the drugs themselves. In a calendar year, when that reaches $2,960, you're in the donut hole. You still have your Part D plan, but it's not working like it used to. You're going to stay in the donut hole until one of two things happens. Either the year ends, because when the year ends, we start back over at 0 and we're starting all over again. Or if you're really unlucky, you spend all the way through the donut hole, meaning you spend a total on drugs of $6,680. At that point, you pop back out the other side of this donut hole. You're in what's called catastrophic coverage. What that means is essentially you have about a 5% copay on your drugs because you already went broke. You already spent all your money to get there. Once upon a time, when I say once upon a time, I'm talking about 2006, when Part D was new. You hit the donut hole, you were out of luck. Your plan didn't cover you at all. What they're doing now is they're throwing in discounts in the donut hole that are going to increase every year. For next year, if I'm in the donut hole, any name brand drug I purchase, you're going to get a 55% discount on. So you're paying a little less than half for a name brand, For a generic drug, you're getting a 35% discount on. So you're paying 65% of it, but the plan pays 35%. What's happening is every year, these discounts are getting bigger. And the donut hole is going to get less and less painful every year between now and 2020. In the year 2020, the donut hole will be gone. So basically, discounts keep increasing, or you can also think of it as the donut hole keeps shrinking until it's gone. And in 2020, it's going to be gone. And we were joking before, they were saying how far away that is. I said, you know what, in 2010, when I first started saying that, it seemed like a really long way away. Now it's only 5 years. So we're going to get there. We're absolutely going to get there. Last thing I'll say about Part D, extra help. Extra help with the Part D. These are a program that if you qualify for it, you can get a drug plan, reduced or no premium, reduced or no deductible, no more than a 15% copay, and no donut hole. Again, it's income-based, and I actually have these figures here. Single person, $1,458. Married, $13,440, and I'm sorry, resources $13,440. Married couple, $1,966, and resources of $26,860. Let's talk about what that means. I'm just going to go with the single here. Income means what comes in a month, gross, meaning Social Security, a pension, wages if you're still working. That's your income. And gross, before Medicare comes out or anything like that, they're talking about what is your gross income. You have to be under that amount. With resources, think of resources as money in the bank, meaning checking, savings, stocks, bonds, IRAs, CDs, if you still have CDs. All that stuff's going to count towards resources. What doesn't count towards resources is your home, as long as you or your spouse live there. As long as you or your spouse live there, what's inside your home doesn't count. You can have a vehicle, it doesn't count. What we get a lot of in Ohio, though, because other property will count. Other property will count. What we get in a lot of Ohio is two different things. We get a family farm that is owned as more than one property. And someone will say, hey, it's just my farm, but according to the IRS, it's two different properties. Well, bad news. Then one of those two properties counts as your resource now. Whichever one the house isn't on now counts as your resource. The other thing we get is someone moves into a permanent facility. I move into a permanent facility, but I still have my house. Now that house, unless you or your spouse live there, your house also counts as a resource. And it doesn't matter that your son is living there and not paying you a dime of rent, it still counts as a resource. But if you're close to this, give us a call, preferably today. If you're not close to it, but you say, hey, I got a neighbor, cousin, best friend who I think might qualify for this, have them give us a call as soon as possible. It's really easy application to do. Our folks will do it with you on the phone. They will do it online while they're on the phone with you. It takes about 10 minutes, 10, 15 minutes tops. Goes off electronically to Medicare. Then you will get a letter back from Medicare in about 4 weeks. That'll either say, yes, I qualified for it, or no, you didn't. If the answer is no, you didn't, you're not out anything. No harm, no foul. You wasted 15 minutes on the phone, but it was worth trying. If you do qualify for it, some folks literally save thousands of dollars a year on their drugs. It's one of the easiest programs to apply for, and it's also one of the ones that is underutilized. It's underutilized. We periodically have to send out, a mailing to this county or that county saying, hey, call us to see if you qualify for this, because we know there's people in Cleveland who qualify who have never bothered to look at it. So if you think you're close, give us a call. If it's not you, if it's a family member or friend, have them give us a call. It's worth doing. All right, we're all through option one here. Original Medicare A and B, secondary insurance, Part D. A lot of you are in that camp. Some of you are over here in this option 2, which is Medicare Advantage. Sometimes called Part C, in case you're wondering where the C went. It's Advantage. What this is, everyone, if you're enrolled in A and B, you can sign up for an Advantage plan. It varies county by county which plans you can sign up for. It says within service area, but here in Ohio it goes county by county. Meaning the plans that you can sign up for in Seneca County aren't going to be the exact same ones you can sign up for in Wood County. Not going to be the exact same thing. And then the only question, the health question they can ask is, do you have end-stage renal disease? Folks with end-stage renal disease, they could sign up for Medicare before they were 65. They can't sign up for an Advantage plan. The rest of you can. The rest of us can. It's an alternative to original Medicare. Easiest way to think about it is this. You still have Medicare. You still have all your same rights and protections that you have as a U.S. citizen with Medicare. But now, all of my medical is being handled by a private company. They're under contract with Medicare, so they have to accept you, but now I'm not carrying a red, white, and blue Medicare card. Now I'm carrying the card of whatever company it is that's my Advantage plan. And I'm going to use that card whenever I go to the doctor, or the hospital, the skilled nursing, whatever it is, I'm going to use that Advantage card. Two options in this part of the state, and actually most of the state, HMO and PPO. HMO means a health maintenance organization. You have a network of doctors and hospitals that you have to use. You go outside a network, you have no coverage at all. The other one is the preferred provider organization. You still have a network of doctors and hospitals. You're going to spend the least amount of money staying in network. However, you can go outside of network. You're just going to pay a little more out of your pocket for that. You can still get coverage, you're just going to pay a little more. And you really see whatever doctor you want. Most of these plans have a Part D wrapped up in them. So I don't have an Advantage plan and a separate Part D. It's all one plan. All one plan. And how they work a little differently, way back when we were talking about the supplement plans, I said they come in after Medicare and pay about everything Medicare doesn't, right? And they're expensive, $200 or so. These are relatively cheaper. There was one in Seneca County last year that I think was $50 a month, $50 a month premium. The difference being is as you use medical services, you're going to have copays. You're going to have copays, meaning, and I'm just throwing these numbers out, family doctor might be a $20 copay every time I go. Specialist might be a $40 copay. I'm going to have a daily copay in the hospital, daily copay in a skilled nursing. So think of it as I'm paying less up front, but I'm going to pay as I go along. Kind of make sense? Okay. Some of you nodded and some of you looked at me like, nope.
I don't know.
Nope, sure didn't. Okay, the open enrollment for Advantage plans, same as Part D, October 15th to December 7th. Just as we can help compare those D plans for you, we can compare the Advantage plans as well. If you've never tried an Advantage plan, you're like, this is the year I'm going to try, this is the time to sign up. If you're on an Advantage plan right now and you say, I want to get rid of this thing and go back to original Medicare, this is the time to do that as well. If you're on one Advantage plan, you want to make sure you're on the best one, comparing to other Advantage plans, we can help you out with that as well. With the D and the Advantage plans, not only can we compare them, we can sign you up for a new plan as well. If you say, you have to tell us, yes, go ahead and sign me up, we can sign you up for a new plan. It will send a message to your new plan saying, as of January 1, I'm going to pay, I know your name, so I'm going to use you. Tom is your new customer. It's also going to send a message to your old plan saying, as of January 1, Thomas is not your customer anymore. The idea there being, we can do it for you. You don't have to talk to the insurance company yourself. Now, I'm going to tell you right now, the old company that you dropped is going to call you to try to get you back. I can promise you that. But just have caller ID, and when you see their name come up, just say, oh, that's just them trying to give me a sales pitch to get me back. Reason we do that is it just for us, for a lot of you, it's nicer if you can just do it clean and not have to deal with the sales agent one way or another. Not have to deal with the sales agent one way or another. The Advantage has a disenrollment period, January 1st to February 14th. So let's say during this open enrollment, I signed up for an Advantage plan. Beginning of the year comes along, and I'm like, you know what? I don't think I wanted this after all. I made a mistake. Those first 45 days of the year, you can drop the Advantage plan, go back to original Medicare, pick up a Part D plan just like nothing ever happened. And that's your dates. Think of it New Year's Day to Valentine's Day. That's your little window of time to do that. That next bullet point is my favorite. It says 5-star rated plans. You can sign up anytime you want. Absolutely can. Guess how many there are in the state of Ohio? None. Exactly. 0. It's very, very hard to get 5 stars. There are some in Ohio that 4.5, but it's very difficult to get rated 5 stars. So here's your options. Option 1, option 2. Which way is better? What should I do? There's not a black and white, one pat answer I can say, yes, do this. Think of it this way. If I'm on original, I owe $104.90. Absolutely. Everybody owes their Part B. I owe $104.90. If I go the supplement route, if I buy a supplement, I said the state average is about $200. So now I'm at $304.90. And I got to pick up a drug plan. So now I'm looking at, I'm just going to go with the averages, 30. A lot of you are going to be able to get out a lot cheaper than that, but I'm going with the average. So I'm going to add 30 on this. Now I'm looking at $334.90 every month. Sick or healthy, every month that's what's coming out. What I get for that are no bills. What I get for that are no bills. I can spend the whole year in the hospital and skilled nursing, and my bills are going to say paid in full. Flip side of the coin here, if I go with the Advantage, I still owe $104.90 because that's my Part B premium. As long as I have Medicare, I owe my Part B premium. $104.90, and I'm going to have generally a relatively cheaper premium on that. So let's go with the 50 because that's easy math for me. Let's say the 50. So I have $154.90 now that I owe every month. Still have more coverage than if I just had A and B. However, I now have co-pays with everything I do. If I go to get any sort of medical service, I'm going to have a co-pay. So this way I paid a heck of a lot of money up front, but I'm not paying anything in bills on the back end, except a little bit of co-pay on the drugs. Co-pay on the drugs. Over here, I paid relatively less up front, but I'm going to have co-pays as I use it. As I go along, I'm going to have those co-pays. So I think of it as I'm going to pay up front, I'm going to pay as I go. Pick your poison, so to speak. We sometimes say, you know, the real trick is to decide right now how sick you want to be for the rest of your life. If you do that, then we know exactly where to get you. Unfortunately, we don't get to decide that. This next, we're almost there. Got 2 slides left. Protecting yourself from unscrupulous sales practices. Open enrollment period. They have 7 weeks to market all of these products to you. And actually, they have more than that. They can start marketing to you October 1st, so it's really 9 weeks. So they really have 9 weeks where they're going to be doing everything they can to beat down your door and get you to sign on the dotted line. The overwhelming majority of insurance agents are good people trying to do the right thing for their clients. That's the only way you stay in business. However, there are folks who make honest mistakes. There are new agents who don't know all the rules, and there are crooks. There are a lot of crooks out there. Of course, there's 2 million people in Ohio on Medicare. There's 50 million in the United States, and every 6 seconds somebody turns 65. If somebody wants to do the math, and since we started at 1, figure out how many people turn 65 just in the time we've been talking. It's been a lot. Here's something the sales agents cannot do. Door-to-door sales. No one should be showing up at your house unless you made an appointment with them. We don't see it a lot in neighborhoods with individual homes. We do see it in senior apartment buildings, things like that. Particularly if it's somewhere where you have a security code, something like that to get in. We'll find an agent who will have an appointment with one person and then be like, you know, I'm going to hang out down in the common areas and see who comes along. It's illegal. It's absolutely against the law. That whole building is your home, and essentially they're in your home uninvited. They're in your home uninvited. Giving out cash gifts exceeding $15. You have an appointment with them, they can give you, a promotional travel mug with their logo. One of the plans had a really nice pocket calculator last year that they were giving out. Perfectly fine. If they tell you that they're going to give you something extravagant, they're going to send you on a cruise. A, they're lying, and B, they're breaking the law. The other tip I want that you guys can get from me is if they do have a promotional item, if you ask for it, they have to give it to you whether or not you sign up or not. So you're within your rights to say, I don't want your lousy plan, but leave that pocket calculator when you get it. And they have to do that by law. By law. High pressure sales tactics. This is one that gets abused a lot. Have a meeting with an agent, they're going to tell you why their plan is the best one. It's the best one and you need to sign up for us today. At which point you can say, no thank you, sign me up, or what most of us say, let me think about it and I'll call you back in a few days. That's it. That's the end of the appointment right there. What we get a lot of is folks saying, well boy, I don't know the next time I'm going to be able to get out to Tiffin. It'd be really great if I could get you to sign this over today, then we don't have to worry about me not getting over here again. Guess what? That statement's illegal. Not allowed to do that. When the meeting's over, when you give them an answer, yes, no, or let me think about it, that's the end of the sales call right there. They can sit and chat about, kids and grandkids and have a cup of coffee. They can't keep trying to get you to sign on the dotted line, though. That is against the law. Basically, you shouldn't have to be trying to kick people out of your house. That's the reason that law's in there. When you're done, you're done. misrepresenting the plan, giving incomplete information. They got to tell you all the bad parts with the good parts. They can't tell you everything it covers without telling you what it costs. And the big one, my favorite here, representing themselves as Medicare. I'm here to tell you right now, tell everybody you know, Medicare is not calling you. They're not calling you on the telephone. They're not sending you an email that you need to respond to. And they sure as heck are not sending somebody out to knock on your door. Isn't going to happen. 50 million Americans on Medicare, they don't have the resources to do that. If Medicare wants to get in touch with you, they will send you a letter through the U.S. mail telling you to call them. Period. Period. What we saw last year during open enrollment period, and we saw it in 88 of 88 counties. So every county in Ohio, we had someone report the same thing, that they got a call at home saying, hey, with this new Affordable Care Act, everybody's getting a new Medicare card. We want to send you yours, but before we do, we got to verify the information on it. So get your card and read everything off of there for me. And every county we went to, somebody gave that information over, and every single one of them got their identity stolen. What happened then later into the open enrollment, they changed the scam up, and they called, said they're from Medicare, and because of the Affordable Care Act, everybody's getting a rebate this year. But we're going to direct deposit those rebates to your checking account. So get a check and read those numbers across the bottom to us. And people willing, I bet you I talked to a dozen people who willingly gave that information over as well. Guess what your checking account balance is the next morning? Zero. So I'm going to tell you, I told you when I started, I want to tell you again. Don't give those numbers out to people who contact you unsolicited. Protect your number. If you call us, we're going to ask for it. If you call Medicare, you call Social Security, you go to the hospital, you go to the doctor. You come to a facility like this. Well, not for today, but I mean if you're coming to stay. They're going to ask for your Medicare number and give it over. But don't give it to someone who contacts you unsolicited. Even, and I'm also going to say, even don't trust your caller ID. Don't do it. Very easy software to buy that you can hack that, even if it's the doctor's office. You went to the doctor this morning, you get a call this afternoon, hey, our computer's crashed, we need to get your information again. Say, great, no problem, I'm going to hang up and call you right back. Go ahead and do it. We can get software, any of us, when I say we, any of us can buy software, put it on our computer, sit right out there in the parking lot. I can give you a call, and that caller ID can say Barack Obama. Meanwhile, it's just me sitting in the parking lot. So don't trust your caller ID. Absolutely don't trust it, and don't give that information over. Don't worry about being rude. Most of us were raised to be polite. I want to give you permission to be rude about this. You know, don't worry that you're going to upset the receptionist at the doctor's office. Just say, I want to call you back just to make sure that you are who I think you are. Better to be thought of as rude than to be broke with your ID stolen. Okay. Got a few of them here. I got a bunch of numbers on the very back page of this. So if you listen to not a word I said, and you're going to go home and throw all this in the garbage, tear off the back page of this and hold on to it, okay? We've got a bunch of numbers. First one on there is our number again, OSHIIP, 1-800-686-1578. 7:30 to 5, Monday through Friday. You're talking to folks in Ohio. Talking to folks in Ohio to help you out. Next one down there, Medicare, 1-800-Medicare. That is 24 hours, 7 days a week. Be aware that you share it with the rest of the country. You share that hotline with the rest of the country. My advice is to call them first thing in the morning. The earlier the better. If you need to get a hold of Medicare for something, if you can call them when you're having your first cup of coffee in the morning, that's the best time to do it. Or if you can't sleep and you want to call them at 2 a.m., that's also a good time to do it. You'll get right through. I can promise you that because I've tried it. Jumping down to the fourth one, the one up here, the Social Security Administration, at 772-1213. That is a 7 a.m. to 7 p.m. number for Social Security. Again, federal number, you share it with the whole country. Closer to 7 a.m. you call, the better. You can call that number and make an appointment at your local office, though. Or I guess the local office is Findlay. But yeah, you can absolutely make an appointment with Social Security. Our friends at Social Security who we do presentations with, have told us to tell folks, if you need to talk to someone, if you need to actually sit down with someone at Social Security, have an appointment. Have an appointment, because they're understaffed and overburdened right now. So the best thing to do is to have an appointment with them. But that pretty much shuts me up, so we're gonna start with a couple questions. Yes, ma'am?
Do you have a local phone number for the Social Security office in Finland?
I do not know. I do not. If you call the 800 number, they'll be able to give it to you, though.
Yeah, I'm trying to avoid calling the 800 number.
Understood.
But actually,
I think it's in that big thick phone book, the direct line to Finland.
But I do not have it, because I have 26 counties that I deal with, so I do not have all those. What else can I answer for you folks? Yes, sir.
Your 14 co-workers down in Columbus and 15,000 people signing up every month. What is the waiting period when you hit 0? Are you talking?
Right now the waiting period's about 1 second.
Please, young man.
Try it right now. You got a cell phone? You can call us right now.
No, I don't. I left it. I'd be rude and have it.
How do we,
Once the open enrollment actually kicks in, October 15th, yeah, there'll be a waiting period. And I can't really tell you what's going to be because it changes every year. I will say we've never had people waiting more than 20, 25 minutes tops.
okay, how do we find out who has the advantage? What insurance or where do we,
Oh, okay. That's one of the things.
and I live in Fostoria, I'm in
Uh-huh.
Seneca, she's in Hancock.
Yeah. Well, Fostoria is, you're in
Yeah.
3 counties, depending on where
And
you're
what's
at in
across the
Fostoria.
street?
Yeah, right. Oh, I'm aware of that, yeah. You're not gonna have to look for the Advantage plans. They're gonna send you ads. But if you do wanna look, best thing to do, give us a call, we can look it up online. You can
I've
look it
never
up
done
online
that.
yourself at Medicare.gov,
Okay,
and it'll have the whole list for Seneca County or Wood County. Absolutely, it'll have the whole list.
because my girlfriend was telling me about this, her mother lives up in the Cleveland area, and she
Yeah.
has it. And I looked, and the only thing I saw anywhere was Seneca, Tiffin.
Okay, well, it wouldn't be just Tiffin, because they're county by county, the Advantage plans.
Right, but that was I don't know, I thought it said Advantage Plan was in Tiffin, I don't know.
But again, in Ohio, the Advantage plans go county by county.
Okay,
So what's available to you in Seneca might not be exactly the same as what's available to her in Wood, you know,
right.
or Hancock, I'm sorry,
Okay.
even though you're right across the street from each other.
It could, well, it can be. I knew a guy that lived here was Hancock, and the
Yes.
next house was Wood,
Yes. Yep, I know that.
Digna. Yeah.
Yep, my grandmother-in-law is in Fostoria, and she's right on the edge of like 3 different counties, so I know how that works. Yes. Yes, ma'am.
My birthday's not until April 7th.
Okay.
Am I still within, can I call or do I have to wait till my birthday?
You can, but you may as well wait. Because you can only sign up 3 months before. Meaning, your birthday's in April. It means you could sign up, we're gonna go backwards, March, February, January. So you may as well wait because the rush is gonna be over in January.
Okay.
See what I'm saying?
The newspaper kept saying everybody should sign up 6 months ahead. But-
Okay?
But I'm not 65 yet, so I wait till.
There's no point
January.
signing up 6 months ahead.
3 months ahead.
3 months ahead.
3 months.
Yeah,
Okay, thank you.
3 months ahead. Your birthday's April 7th? Is that what you said?
April 7th.
That's my daughter's birthday. I just wanted to share that with you.
How old is your daughter?
She's 6.
I'm
Sweet. Oh.
Yes, sir.
You may not have the answer, but what's the advantage to the hospital to keep you on the observation mode for more than 3 days versus enrolling you or?
I do know the answer to that. What it has to do with is readmission. Hospitals lose money on a readmission, meaning if I'm in the hospital for a certain condition, they admit me, they send me home, and I go back to the hospital for the same condition, they lose money on that. If they never admitted me the first time, then I'm not a readmission. That's their advantage. Why they do it. I shouldn't say advantage because that's going to confuse it. That's why they do it. Yeah, it's one of the most frustrating things going on right
Was an
now.
observation only like 24, 48 hours?
Used to be.
Depends on the hospital
Used to be.
system.
I was gonna say, when I worked at the hospital.
It's really every hospital system has their own guidelines. I mean, there's not a law yet. And I say yet because I'm sure something's coming. There's not a law yet to limit that. But it's
We
every.
hated observation patients.
But I promise you, if you Google observation stage, you're going to hear horror stories. We had one up in Toledo where this poor fellow was in observation for 8 days.
Really?
I'm thinking after 8 days, you're gonna tell me this guy didn't need to be admitted,
Right.
you know?
Yeah, give me.
Because how many people do you know have been in the hospital 8 days? Not many.
Not really.
Not many. Anything else? Well, I'm gonna hang out up front. If you guys had a question you wanted to ask we didn't get to, but other than that, I'm done. Thank you guys for your time.
Thank you, David, for being here today. We appreciate it.
Thank you very much.
Green book that I've got.